I've been learning from Dr. Yin since last year. It is a modern tongue diagnosis online course. It is very useful, especially during this epidemic. We only need to take picture of patient tongue for analysis, and then we can either prescribe Chinese medicine or apply acupuncture treatment for them. So it's very useful, and we can use it in our daily practice. "65 people. There are still some people troubleshooting for this thing.
Hi, Grace.
Hi, tell me where you come from. Good morning, good afternoon, good evening.
Good evening. Yeah, this is George. I'm from Bali, Indonesia.
Welcome.
Thank you. I just heard this news like 10 minutes ago. So luckily I can still join. Thank you.
You're welcome. So right now you can only type anything you want to speak in the chat box, because I'm going to mute all of you because we're going to start soon. Sorry. Dr. Ying, is it we can start now? Hi, Dr. Ying, can you hear me? Hi, Dr. Ricardo, welcome. So, Dr. Ying, can we start now?
Yeah, we can start now. Let's check the sound. Okay.
Well, guys, please get the paper and notes ready. We are going to start now. Today, we are honored to invite Dr. Hong Chun Ying from London, the founder of Modern Tongue Diagnostics, to give us a talk about Introduction to Modern Tongue Diagnostics. First, let me introduce a little bit of Dr. Ying. Dr. Ying is his training in Shandong, China, and continues to become the duty chief physician in Qingdao Hospital of them. He currently practices in London, England. His experience with tongue comes from 30 years of clinical experience, research, and publishing books detailing modern diagnostics in Chinese medicine. Dr. Yin is also an academic director of traditional Chinese medicine in the UK, as well as a member of the editorial boards and an editor of Journal of Chinese Medicine in the UK, where he creates articles and journals. He continues to share his knowledge with practitioners, government officials, and academics all over the world. Now let's welcome Dr. Ying to start his lecture today. All good. Dr. Ying, you can start now.
Okay, thanks for your introduction. Let's read the brief introduction of modern tongue diagnostics. This modern diagnostics what is modern tongue diagnostics? And Ying's modern tongue diagnostics in Chinese is a new discipline. It integrates diagnosis and treatment based on traditional tongue diagnosis, combined with holographic theory, experience of doctors, and modern theory. This definition included 4 modern tongue diagnostics, included or absorbed all the best knowledge from the traditional tongue diagnosis. Second is combined with holographic audit theory. The third is combined or absorbed the modern doctor's experience in the tongue diagnosis. And most content is my own discovery.
老师可能要讲大声一点。
现在声音行了吗？
刚才有点小声，现在可以了。
现在可以了啊。好了，那个我来let's brief review the history of tongue diagnosis in Chinese medicine. In the first Chinese book of medicine is called Huangdi Neijing. In this book, there are no doesn't exactly to make the tongue information as a diagnostics information. Just only the abnormal appearance of the tongue was recorded, like curled up tongue, dry tongue, stiff tongue, yellow tongue, just like this. So it's not much more information. And the second important book in Chinese medicine history is called Shanghan Zabing Lun. In this book, also have recorded some tongue information, like in the Yang syndrome. They said the Yang syndrome with tongue coating, so they need to use 小承气汤. That means if you see the tongue is white or yellow, but it's dry, so you can use 小承气汤. And another paragraph show 脏结 with white and slippery coating. And if you see this kind of tongue, then you will know this patient is difficult to treat. Because when the patients get a white and slippery coating, that means their yang energy or yang qi is very, very deficiency. So you need to use powerful herbals or medicine to tonic the patient's yang. But this is not easy. That's why they said when you see this kind of tongue, so you will know this patient is not easy to treat and not easy to recover. And third book also is the important book in Chinese medicine tongue diagnosis history. It is the first book called 敖氏伤寒金镜录. This is the first tongue diagnosis book in Chinese medicine history. It appeared in Jin and Yuan dynasty. This book has recorded 36 tongue, and every tongue they come with their treatment prescription. The fourth important book is called 舌尖辩证. Is this one? This is the fourth one, and this book extended the tongue diagnosis from the acute exogenous disease to internal disease. This is a big step. Yeah, and the fifth book is appeared in Republic of China time, roughly is in 1920 to 1930. In this book, incorporate modern medical anatomy and physiology. And also this book accumulated or collected all the tongue diagnosis information from the previous history. After the Republic of China, then to the holographic tongue diagnosis appear. In this time, the tongue diagnosis no much achievement. Until in this century, the holographic tongue diagnosis start come, and my book was published. The English book published 2 years ago, and the Chinese edition published this year in January. So the complete system of modern tongue diagnosis appear now. Let's we talk about the importance of modern tongue diagnostics. I said, the value of tongue, the root of all physical phenomena, belongs to the tongue. All your body problem, it can show on your tongue. Not only show on your pulse. If you are good to read the tongue, you can read the whole body information. The tongue diagnosis is the most typical diagnosis of concrete manifestations in the 4 diagnoses. We know in Chinese medicine diagnosis method, normally we say have 4. Interrogation, we ask patients information. This is an easy way, of course. If you know how to ask, also is important. It is very good for you and the patients. But for some patients, they can't express their problem clearly, like the children, like some mental problem patients. So you cannot depend on the interrogation method to get the information, to collect the information. This is and also the interrogation method is not really reliable, because many times the patients don't know their main complaint, and maybe they will give you the false information. So that's why this diagnosis method is the most not reliable method. And the second we know is called inspection. Through our eye, we can see the patient's information like the face, like the whole body, and the colors, the movement, the spirit, everything, including the tongue. And the third is auscultation and olfaction. We through our nose and ear. We use our nose and the ear to collect the information about the patient from the patients. The fourth is the pulse taking and the palpation. Pulse taking and the palpation, it is very useful. And the two diagnosis in Chinese, two diagnosis method, it is very important for every Chinese medicine doctor, the pulse taking and the tongue reading. The pulse taking, of course, if you are very good, you can get all the information. The problem is it is very hard to sharp your technique. It is need to take many years, and you need to get a very good master to teach you. The tongue reading is not that difficult, because if your eye do not have problem, that's be very easy to read the information if you just get some kind of training. Tongue diagnosis itself has been developed in previous treatment of epidemic disease, especially in the Qing dynasty with the knowledge in epidemic febrile disease. The tongue diagnosis of TCM also made unprecedented progress. Of course, even this time, we get COVID-19 epidemic. Tongue diagnosis as a unique diagnosis method of Chinese medicine was widely used by frontline doctors of Chinese medicine as the main basis of diagnosis and treatment. Before this, epidemic disease, so many Chinese medicine doctor doesn't see the tongue reading important, because this problem happened. We cannot directly touch or face to the patients, so the distance diagnosis method, it is very important. So the tongue reading, so everyone know the tongue reading can be used as the main diagnosis method. And the last is a unique advantage in telemedicine. Of course, when we treat the far distance patients, we need to get a solid, information from the patients. So this is the tongue diagnosis. So it's more important. Let's see what I try to do, I want to develop is the visualization of TCM theory. ModernTongue Diagnostics committed to the visualization of TCM theory. It's through the following few methods. First, we made the clear, tongue holographic picture. And the second, Yin's modern tongue diagnosis has its unique theory, is the tongue midline theory and the 10 outlines of syndrome. This 10 outlines of syndrome, we know like 10 principles. Generally, when we study in university, we train them in any Chinese medicine school. The teacher will taught you 8 principles, not the 10. I developed it to 10 plus the qi movement. The third is I made very clear about the Sandio and 6 gene division in tongue. Also the 8 extra channels and 9 palace division in tongue. Another important is only tongue, no syndrome system. That means we treat the patients with herbals and acupuncture points is based on tongue diagnosis, not based on the patient's complaint. The reason for create MTD, modern tongue diagnosis, I talk why I created a new system. It is not 100% new because inside we use a lot for traditional theory, but is abstract the concept. It is abstract concept. Sorry. My system have the traditional Chinese medicine diagnosis knowledge inside, also have the holographic theory inside. The traditional Chinese medicine theory is not easy to understand, especially like yin and yang, or like hot or cold. This kind of thing is not very clear conception. The second is the limitation of traditional diagnostic method. Just I talked, we use the pulse diagnosis, we use tongue reading, we use interrogations, but this is not enough. We cannot get a very solid, concrete information to support the diagnosis. And the third, the imprecisions in traditional ways of choosing herbs and prescriptions. We treat the same patients. We use many different prescriptions. Different doctor will use different medicine. And you cannot argue because everyone hold their own diagnosis. This is because the standard is quite different. The standard is not same. So made the when we chose the medicines is so many different way, and there are no very solid or unique or how to say exactly the right way to choose the medicine is not very clear. And of course, the result of the treatment or the effect of the treatment is not reliable. It's not correct. I just from the previous talk, we know we need to change something. So the MTD have this own advantage. Yeah. First is made the traditional Chinese medicine theory with label. Second, is more accurate for disease diagnosis and syndrome differentiation. The third is the persistence in choosing herbals and prescriptions. Because every tongue sign, we have a unique herb to match it, or we have the unique acupuncture point to match it. So this made the prescription much accurate with your diagnosis. Of course, the treatment effect will be more reliable. My system have some characteristics. First is accurate holographic corresponding system. Second is a unique tongue by a hologram. Third is the discovery of the head and the neck gland reflex zone on the tongue. This is an important step for the holographic tongue diagnosis. And the fourth is a comprehensive tongue herbal medicine and tongue acupuncture corresponding system. 5 is the unique tongue midline theory. 6 is differentiation with 10 principle. This is the 6 characteristics of my system. ModernTongue Diagnostics contains 2 important parts. The first one is disease diagnosis and syndrome differentiation by tongue. This is the first one. The second is give treatment by tongue. I called it only tongue, no syndrome. Let's brief talk about the history of tongue hologram. The first picture we see is picture A. It is from the very ancient Chinese word called oracle word. You see this word. To see the picture B, I put this word to match the human tongue. You can see this part is like a head, and this in the middle, there are 2 lines, is like an arm, and this on the root is like 2 legs. So the tongue word in Chinese medicine in oracle writing is exactly like a human body. Let's see this one, C. Picture C is a copy from Qing Dynasty book. And in this picture is, I said it is ancient holographic tongue diagnosis picture. And you can see there, right, the Chinese word in this tongue. You see the left side is liver, the right side is lung, and on the tip or the top part is the lung. No, sorry. This part here is the gallbladder. Top part is lung and heart. In the middle part, the left middle is the stomach, and the right middle is the spleen. On the root or on the back of the tongue is the kidney and the large intestine. This is a very old or ancient tongue hologram. And this one, this picture not made by me. It is designed by Dr. Guo, who has been died a few years ago. This is a very modern hologram picture. And but this picture, let's see, the design have a few problems. First, he put the heart on the tips of the tongue. This is wrong. And the second, he didn't show where is the arm and where is the leg. This is my picture, my tongue hologram picture. Let's see. You can easily to see what's the human body appear on the tongue. Let's see a big picture. Okay. From this picture, we can see a human body appears on the tongue as if it lies on the tongue on its belly and with its face facing forward. This is important. First is lie on its belly. Second is facing forward, and the head and the face are located on the tip, while the forelimbs are bent and located on the edge of the tongue. The shoulders and the wrist are close to or next to each other. The elbow and knee are next to each other at the middle part of the edge of the tongue. So on the bottom of the tongue, this part, let's see, this part will be the hip joint and the ankle. And from this picture, then we know in the middle part should be the spine. So this picture is an important picture in the tongue diagnosis history, so everyone should be remember it. This page just talk the traditional heart location and holographic heart location. In this area, blue arrow point is the holographic heart, and this on the tips, this is the traditional heart location. When we see the tips of the heart red, we say this person their heart fire floating up. This part, we see a heart problem. If the heart any problem happened, you will see in this area very clear, is very easy to see it. Let's see one case. Look at these patients. This tongue I circled in this area with the black color. This is a heart reflection area. And these patients had, because of the heart disease, get a heart transplant. And also these patients have another problem, is the breast has been, because of the breast cancer, has been removed the right side breast. And we can see this area like a rotten wood, and also have some crack. So we know these patients have a serious heart condition. The heart energy leak, and then we see the immune system will be very low. So the patients will be easy suffer many kind of cancer problem. The breast cancer is the easy to get, especially when the patients also get the liver stagnation. Let's see the qi movement diagram. This is called qi ascending, descending diagram. In this diagram, I will show three pair of the qi movement. The first pair, let's see the big line is this the blue, the green one is wood is represent the liver qi movement. The white one, the white arrow, represent the metal is the lung qi movement. Those is a big circle to show on human tongue. And the second, we see the small circle, or we call it the core circle, because in the center is the yellow one is the spleen. This blue one is stomach. The stomach qi should descending, and the spleen qi should be ascending. Like the wood, the liver qi should ascending, and lung qi descending. And in the middle, there are two straight lines, one black, one red, to show the water and the fire communicate. The water should be ascending to the top, to the fire, and the fire should be descending to the back, to the bottom, to the kidney, this part. And these three normally is we see it is more important than any others. So when we see any tongue, normally we'll look the three pair of the qi movement. Is especially the left side and the right side, the wood and the metal qi movement is more important. And of course, the water fire also is important. Differentiation with the 10 principles. The 10 principles is is my system important part of my system. So the qi movement is not a new series and not new things. From Huangdi Neijing, we can see there are a lot of talk about, or a lot of talk or a lot of description, describe, just lot of talk about the qi movement, qi ascending and descending. But in Qing Dynasty, when we made 8 principles, we forget to put in the qi movement, these 2 pair, the ascending and the descending pair. So it is made the diagnosis not easy. If plus these 2, so the diagnosis will be more accurate and more easy. And so we know the 8 principles is yin-yang, exterior and interior, heat and cold, differences and excesses. And plus these 2, then make it as 10. Why we talk about the 10? Because when we see this picture, especially when we see the midline, we are easy to separate the left and the right side of the tongue. So we know which side the qi gets blockage, which side the qi is shortage. So made the qi movement diagnosis much easier. let's see the 三焦 and the 六经 三焦 I'll just see the 三焦 division. We can easily to separate the tongue to 3 parts. Normally we make 3 equal parts, but that's not not the exactly way, accurate way. If you want to make it exactly 3焦, we need to use we need to know where is the upper and middle jaw division line, and where is the middle and lower jaw division line. The upper and middle jaw division line, we in my system are defined from the zhongqing point. It's this part. If you don't know the zhongqing point, is this point? Yeah, in the yin channel here. And another point here is called umbilicus. From here to separate the middle and the lower jaw. So normally we need a measure from here to the zhongqing point, from the zhongqing point to the umbilicus, from umbilicus to the upper border of the pubic. From this midline, we get the proportion, and we put this proportion on the tongue midline, saying we know where is the point, zhongqing point and the qi point. Saying we make 2 parallel line, so separate the tongue to 3 parts. And from these 3 parts, then we will know will be important to know, to diagnosis is which organ get the problem. Like we put the heart, lung, and the breast on the upper jaw. We put the liver, stomach, spleen, and pancreas in the middle jaw, and we put the kidney, bladder, uterus, large intestine, rectums, all in the middle, the lower jaw. Another is just see, this is a 三焦. How to divide the 三焦. Another is 三焦 channel, 三焦 meridian. 三焦 meridian, when we see scalloped tongue, teeth-printed tongue, and this means these patients get 三焦 yang deficiency. So because of 三焦, we make it in the on the edge of the tongue. You see this kind of shape, you know the 三焦 show their shapes. That means the 三焦 yang energy is much lower. This picture to show what is the 8 extra channels. Here just show 2, the Ren channel and Du channel. Let's see this one. This one is governor meridian. Governor meridian is a Du channel. If you see the midline have the crack, so we know this is the Du channel get problem. And if you see the midline get convicted like this shape, yeah. So it's not a crack. So we know it's the conception channel, conception meridian get problem. This to tell how to observe the back of the tongue. Just see back to the front page. Yeah. We have all others. This just talk two meridian, the ren and du. We also have Cheng meridian and De meridian or another four. So in my book, you can see some, but not all. Not right in the book. Some I need to teach in my class. This is talk when we see the back of the tongue, what we should see. First, we see, of course, the important is the two bigger wing and the bottom of the tongue. But most, we also to see the small one. And from the small one, we can see the content in the blood. Yeah, like the sugar, the uric acid, the fat. I don't know. I have the time to finish all the keys. Let's see. I'll give this key. Okay.
可以啦，老师，可以。
可以啊。Let's see the case 2. Case 2 is a COVID-19 case. This patient himself is a doctor. And he was tested positive. And his main complaint is dry mouth, dry cough, chills, and fever, and diarrhea for 5 days. And from the tongue diagnosis, we can see the middle jaw damp blockage, stagnated height of Shaoyang channel. And put this way, it will be easy. When we clear the diagnosis, it will be easy to give a prescription. So these patients, I use the two prescription, two decoction together. One is called Xiao Chai Hu Tang, another called Ping Wei San. We use the two and mix it, and then that's the prescription is Chai Hu. Hope the first one is made wrong. The first one should be Chai Hu. Hope, Chen Pi, Qing Ban Xia, Chai Hu. The first one is Cangzhu. Sorry, the first one is Cangzhu. Chai Hu here. Huang Qin, Dang Shen, Zhi Gan Cao, Sheng Jiang. This patient just drink 5 days tea, and then the diarrhea finish, stopped, and the fever stopped, and he just back to work. Let's see the first case. And the first case also himself is a doctor. Is in London. Is an NHS doctor. And he works in the front line as an anesthetic doctor. You know, when the patients need put a tube through the air track going to their lung, that's his job. So he just did a few cases, then he catch the virus, and he also spread the virus to his wife. He just sent the tongue picture to me, and from the tongue picture, I can see this is an early stage of infection, and the fever is 39 degrees. And the epidemic attacked the exterior lung field, dispersing outward and upward. The lower part of his tongue has a white, greasy coating, and indicating cold and dampness in the lower lower part of his body, and especially we say lower abdomen. Upper and middle parts are red. It's a toxic pathogenic factor transformed into heat. The tongue shape presents stagnated heat in Shaoyang meridian. Yeah, we can see, especially this part, all is red. So you see this is heated up. The prescription use a lot of herbals. So I will leave the PPT to you, so you don't have to write it. And after this herbal treatment, the temperature going down, but in the night it's still a little higher, 39. Daytime is 37. And the patients continue use the tea for another day. Is the temperature getting much better? Yeah. And in the 7th of April, the patients no fever, just take a half dose of the herbals. And in the 8th of April, the patient's temperature still is normal. And so he don't want to drink the tea. He just uses some herbal products. We call the 人参百度散 and plus some like cold herbals. On the 9th of April, the patients lose the smell, loss of smell and taste, and feel tired and poor appetite. So just let him continue use the previous day use the herbals. And 10th of April, the patients has changed some tea as the following one is used because the tongue feel a little greasy. So I use some herbals to just for eliminated the dampness. And the 11th, the hospital come the result of the blood test, tell this the patients it is confirmed COVID-19 infection, and the patients feel after the herbals through this treatment, the patient feel very good, back to normal, and the smells and the taste is restored. So he just back to work. We don't know. He didn't test, the blood because the frontline shortage of the doctor. So he has to back to work. Let's see case 3. Case 3 is patients with lower temperature and cough and scanty sputum. Also have anorexia, lost appetite. I gave the herbals you can see is 柴胡、黄芩、干姜、五味子、白术、宽灯花、hope、苍术、陈皮、白术、胡杖、炒薏仁、炒白扁豆、草果、炙甘草。These patients use the concentrated herbals. It's 12 grams each time, twice a day. After a week, the patient's temperature is finished, is back to normal, and appetite is back to some. So we can see the tongue fur is also is getting less than before. Look at this, before the tongue fur is much thick, white and thick. And this tongue fur also is become shallow. So I just take off some cold herbs and plus some warm herbs. Yeah, remove chai huangqi and huzhang from the last prescription and added ganjiang and caoguo. Use these two herbs also to remove the greasy tongue fur. This case is she is my student. She also catch the tongue fur. She is a Germany doctor, and this patient I have treated her nearly 2 months because it's a long time. First, she get a high temperature, cough, difficult to breathe, and after drink the herbal tea, all these symptoms gone, but the breath is very difficult, and made her needed to call the ambulance. But anyway, she didn't call. She stayed home and passed the difficult time, but the first time blood test, it shows still the virus infection positive. So she cannot back to his position to work, and after 1 more week treatment, the test show 2 tests show the virus has been finished. So then she back to normal work. Let's see her prescription. She just write this information to me. The COVID-19 test in past 2 days have come back all negative. Coughing has decreased, but have quite high volume of white sticky sputum, especially in the morning and after food. Pain in left shoulder and neck, but hay fever are better. Still lack of energy. Felt left chest discomfort at 5 p.m. Today. Bowel movement is more regular. Appetite is back to normal. Temperature 36.6 degree. Blood oxygen 97 and HR was 74. So the patient's getting much better. That's why she came back to normal work. So let's see another case, damp and febrile disease. Look, see the right side tongue. The right side tongue show the tongue is red, and the tongue fur is yellow, greasy, and thick. And also up part of the tongue, the tips part of the tongue, lost some tongue fur. And let's see the left side. The left side is tongue. The tongue is not that red, and the tongue fur is much shallow, and there no yellow greasy, just a little white. And let's see the right side. The tongue midline. This tongue midline is moved to the left side. If you draw the midline, then you know it's moved. is moved to the left side, and you see this is nearly back to middle. Yeah, this is much normal. And this is the patients use the prescription, use the 茵陈花石汤草石菖蒲黄连黄芩厚朴杏仁砂仁薏仁。This prescription is come from 三仁汤, very famous Chinese decoction. So it's mainly used for dampness heat or dampness. After 5 days, the patient was able to be discharged from the hospital. Just feeling generally well, but still has some loose stool, relatively dark color. What's this mean? I think these patients, we suppose, gave 3 bags of the herbal tea, but instead 3 gave 5. So that's why made the body a little cold more. So I just remove the 2 cold herbals. So give let the patient drink another few days. So the patient back to normal. This is another case. It's leg edema. It's the swelling in lower leg. This patient is 90 years old, live in a very big hospital in China, and nearly half a year, but the edema the leg edema did not disappear. Instead, become worse, and the patient even cannot walk. So the family member sent me the picture, before treatment, the picture to me. When I analyze this picture, we can see the tongue midline move to the the right side, show this part is much bigger. And the tongue fur is yellow, white, greasy, and plus little yellow greasy, especially in the left side. And all this indicated the liver qi stagnation, stomach qi stagnation, spleen qi deficiency, and kidney yang energy deficiency, and also some heat accumulated in the stomach. So I gave a herbal prescription. After 1 week, the family sent me the picture, tongue picture like this one, the right side one. This we can see the midline nearly back to normal. Look here, the midline is like this way. Yeah, look here, the midline nearly back to normal, and the yellow, white, yellow, greasy tongue fur nearly finished. Yeah, and of course, the patients get a very good result. His edema just finished, just 1 week. So let's see the what's the herbal I give to her and to him is use the 党参生白术茯苓皮肉桂柴胡陈皮厚朴鸡内金炙甘草肉苁蓉冬瓜仁桃仁桃杏仁生麦芽炙壳川牛膝枸杞子生地黄炙甘草大黄only 6 bag. After a week, the patient's edema get significantly improved, much reduced. and he can walk. And the tongue picture, of course, we just show to you, get much changed. So it means the treatment is really work. And then I continue give some other herbs to the patients discharged from this hospital. This just show early stage of nearly when I start the record the tongue. That time we have started to use the digital camera. This two picture is from my storage. All others I have lost. This is my book as published as I talk in the beginning. This is the English book. It's if you want to buy from Amazon, you can buy the second edition. Don't buy the first one. And this book, if you understand Mandarin, you can get from Malaysia. The Yong Ho company, or you can get from China. This is modern tongue diagnosis, knowledge inheritance and organization. I have recent years I have taught and trained thousands of doctors to study my technique. So this is in Switzerland. This is in London. This is the advanced class, training class in London last year. Oh no, sorry. This one is this picture is the advanced class in London last year. This picture is in 2018. I back to my university to celebrate the 60 years anniversary. So I gave a speech for modern tongue diagnosis principles and the 10 principles. This is in London when we hold the conference and the meeting. Okay, everyone, if you have any question, because my English is not very good. If you do not understand, just ask me.
I think you can type your question if you want to ask. We don't have much time for question. Anyway, if you want to ask, you can type your question, please. How much is the book? How much is the book, Dr. Yin? English version, right?
On Amazon, it's £50. Yeah, but if you buy your school buy, maybe you can get some discount. So I can make the price. I can talk to them, make the price cheaper. If you like, you
do you have an online course? Yes, we are planning to do English online course. I will announce later. When are you planning to do another course in London? When are you planning to do another course in London, Dr. Yin?
You mean the advanced class? The advanced class in London, I planned this year, but because of the virus, we have to postpone. So the exact time has not yet decided.
Okay, any more questions? Would you explain the correlation of your tongue maps with one of the case.
Which one? No, this case. This one.
举一个例子给他就好了。
你说举一个什么例子？
那就是要那个你的那个，他是说你可能解析那个舌象。
哦，给他解释一个舌象吧。
对对对。
我给他解一个舌象吧，我给他就解这一个舌象，不是他们可以看的。Everyone, can you see this this tongue? Yeah, this case I treated a few years ago. I think I treated 2015 or even earlier, this case. And he's my friend. Her mom live in Qingdao, in Qingdao, the largest hospital, because the temperature higher and a little cough. So the hospital gave the CT scan and to show the lung is not clear. It's like like a foggy type lung. So they said they suspect that these patients get lung cancer. So they want to make take a sample to test it from the lung. And my friend just asked me if I can treat with herbals without any other, damaged kind of exam or treatment. I said, okay, you just send me the picture, tongue picture, let me analysis. From this picture, we can see tongue fur is yellow and greasy. This means it's dampness heat. Then tongue midline. The tongue midline goes to the left side, show the right side bigger. Right side bigger, that means the lung qi and the large intestinal qi stagnation. And also here we get a little, the shortage of the tongue fur cover. That means here is the lung, especially the right side lung, fully heated up, cause the the liquid loss. So from this analysis, I give the herbals. Yeah, based the basic herbal, basic decoction is thyron tongue. This tongue is use thyron tongue and then plus some different some other herb like yin chen. Yeah. Plus yin chen, huang qin, huang lian. These three herbs. The patients use it, of course, is a really good result. We can measure the before and the after. Okay, any question?
Well, if no more questions, okay, thank you very much. Last question now, where does that idea of channel relationship in the tongue come from?
Yeah.
Where does that idea of channel relationship in the tongue come from?
Channel relationship. What's this? The question is the channel relationship, right?
他可能
你再
他的意思，
给我说
他可能他的意思是说，比如说你分的这种经络，在舌象上看的经络的那种概念是从哪里拿来的？
从哪里拿来的？这
可能是那个
这个
跟那个什么少阳经啊，什么经络的关系吧，舌象跟经络的关系。
是
我也不大明白。
这个 this need I think after he study my book he will understand. Yeah. Every sign shown on the tongue is related with all the organs and meridians. So it's not difficult to distinguish which channel get a problem, which meridian get a problem.
I read the book, but I could not find information about black spots on the tongue. Could you talk about black
spots?
Spots on the tongue.
Black spots on the tongue. Black spots on the tongue, roughly, simply we can separate the two. One is the normal, one is the pathogenic, is abnormal. The normal one is normally hired from their family or their race, like they are black people or they are dark the Indian people. So they are easy get the black spots on their tongue. And this is a normal sign, so we don't treat it as a problem, as a pathogenic factor. Another one is abnormal one. Abnormal one, if you appear on the tongue of the surface, so we can see it, and we see it as blood stasis. It depends on the area, in which area of the black spots or black dot on the tongue. So we normally will define is in which organ get blood stasis. And another, if this black dot or black spots show on the tips of the tongue, normally we say this is a long-term stress. The liver fire already finished, but left the stagnation, blood stagnation in their livers. So it depends where appear of the on the tongue.
In your books, a part of diagnosis, is there any medicine with herbs and needles? 有处方吗？
The book have a lot of prescriptions, a lot of prescriptions. Yeah.
What you mean by tips of tongue? Tips of tongue.
Tips.
Actually, it's quite complicated. Need to learn.
The tips. Yeah, the tips of the tongue. I think if they never taught, this system, it will be new for them to learn. So maybe a little problem, but anyway, it's not too difficult. Yeah. Okay, it's like a microanatomy. Yeah. Okay.
Well, I think you guys need to learn if you really want to learn from Dr. Yin about this modern tongue diagnostics, because it's very different from what we learned before. It's really a new system, but it's very useful to our clinical practice. I'm using it since last year when I learned from Dr. Yin. I think the accuracy is very high. And we just need to snatch one of the patient's tongue, then we can analyze and diagnose from the tongue very correctly. Well, once again, thank you, Dr. Yin, for giving us the opportunity today for this webinar. Thank you guys for spending your valuable time to join us. Well, there's also a good news to all of you. Is actually we already started our online course for Modern Tongue Diagnostics in Chinese version. We are preparing to do an English version online course as well. If you guys are interested to learn, please let me know your name later and we'll inform you when we are ready to start the class. By the way, for those who miss out or want to catch back this webinar, please follow us on our Facebook private group. We will play back this webinar on our Facebook group. The group name is Yong Ho TCM Center Study Group. You can also introduce this group to your colleagues too, if they can't make it to join us this time. Well, I think now please turn on your video. We can take a picture. Please turn on your video, everyone here. Hi, the assistant is going to help us to take a picture before we leave.
Okay, thanks everyone. Yeah, have a good night.
Yeah, thank you, Dr. Yin, for joining us today.
Okay.
Thank you, everyone. Stay safe and take care. Have a wonderful night or wonderful day. See you soon again. Bye.
Bye.
Bye. Thank you very much.